So we are with the third writing session for today, writing feedback. This is Grandmaster class and I'm Peter Simon with you. Today we are correcting the letter of Gargi, Satija, Delhi, India. Name of the patient is Mr. Gerald Baker and the case is left total hip replacement, and this is a nursing specific writing task. So here we are, Gerald Baker. Yes. So little clarity is needed here. So next time when you take picture, take it neatly. And then Mrs. Samantha Bruin, senior nurse, Grey Walls Nursing Home, 77 Station Road, Grey Walls, 7 September 2010. Here you have to leave some space after 7 and here also little space. Okay, regarding after colon little more space. Okay, Mr. Gerald Baker, colon after colon space, aged 79. No need of hyphen. Hyphen is not needed. Dear nurse, the purpose of this letter is to update you about Mr. Gerald Baker, who is being discharged back to your care today. He is recuperating well. Okay. So he is recuperating well. That's fine. But if you say it's only now, he is recuperating means it is now. So he has been recuperating after the left total hip replacement surgery. So replacement, okay. After a left hip replacement A and requires continuing care. Okay. Okay. So Mr. Gerald Baker left total hip replacement, nursing, and feedback. Okay, this is Gargi, Satija. Yeah, right. Mm. He has been recuperating well. He has been recuperating well would be better. He has been recuperating well. After A left total hip replacement, A left total hip replacement. A left total hip replacement. Requires continuing care and appropriate management. Requires continuing care and appropriate management. Post-operatively is one word. Post-operatively is one word. Okay. You can see here if you want in Cambridge Dictionary. Post-operatively is one word. So you have to write one word. Right. Alicia made a bit tight. Okay. Post-operatively. Right. So Mr. Baker, post-operatively, Mr. Baker was commenced on aspirin along with his medication for hypertension. Mr. Baker was commenced on post-operatively. Why Mr. Baker? No need. It's not necessary. Why don't you write passive voice? Okay. Aspirin was commenced. Aspirin was commenced. Has been commenced. In addition to the already existing medication, for hypertension. Pain relief spelling mistake. He requires Panadin for pain relief. Okay. Panadine Fort is required for pain relief, or Panadine Fort. Okay, pain relief has been effectively managed. Okay, Panadine Fort is required for pain relief. Okay. Panadine Fort is required for pain relief. He requires remove he. It's correct only, not wrong, but why active voice? He requires. So Panadine Fort is required for pain relief. So you can use passive voice. Panadine Fort is required for pain relief. Regular dressings of the surgical incision site and daily dressings. Regular daily dressing changes have been provided. At the surgical incision site for preserving the skin integrity. Are highly recommended for recovery. Hence, there is no connection. You can put a full stop. There are three things: range of motion, stretching and strengthening exercises. Exercises spelling. What is the spelling of exercises? EXERYCER. And occupational therapy are high. Three things are there: range of motion, stretching and strengthening exercises, and occupational therapy. How many things are there? So are highly recommended. Are highly recommended. We are sending a wheelie walker. A wheelie walker and a wedge pillow have been provided. A wheelie walker and a wedge pillow have been provided. In addition, a toilet raiser has been hired for 4 weeks from a local medical supplier. It is not an higher. And higher of toilet razor will be organized. Okay. A toilet razor will be hired from a local medical supplier for 2 weeks by our social worker. No need to tell about our social worker. Okay, really, toilet razor is important. Social worker is not important. From where he has taken is not important. By whom is taken not important, but from where and what is important more. During recovery period, during post-operative recovery or post-operatively, Mr. Baker appeared to be disoriented regarding time and place, possibly due to anesthetic effect. However, ongoing monitoring is recommended, not continuing or ongoing. So, Mr. Baker's hemoglobin levels dropped post-operatively. So already told here during recovery period. So during post-operative recovery, that's enough. There only if you write here and again post-operatively, no need. He was transfused with post-operative, dropped, full stop. Post-operatively is one word. However, regular monitoring is recommended. Regular monitoring is recommended. So here I can say post-operative disorientation regarding time and place. Post-operative disorientation regarding time and place were noticed. Post-operative disorientation regarding time and place, possibly due to anesthetic effect. Okay, has been noticed. Sorry, post-operative disorientation has been noticed. Mr. Baker's hemoglobin level dropped. So post-operatively, therefore, he was transferred. Hemoglobin levels dropped, comma, and therefore, comma, 3 units of packed red blood cells have been transfused. Without any complications, no need to write. Hemoglobin levels dropped. Okay. Hemoglobin levels have dropped. And therefore, 3 units of packed red blood cells have been transfused. Okay, without any complications is not necessary. If there are any complications, you have to write. There is no problem. So why should you write that? Now, his hemoglobin level is stable. Okay. So here you can continue. For stabilizing hemoglobin levels. So you can eliminate one place anywhere. Hemoglobin levels 2 times, no need. So hemoglobin levels were not stable. That's why they were stabilized. So hemoglobin levels have dropped and therefore 3 units of packed red blood cells have been transfused. That is enough. Okay. So either write that one before or write afterwards. This is enough. No need. So we remove hemoglobin levels have dropped and say for stabilizing. That means they were not stable. That's the meaning. It's the same topic restated. Please observe for any signs of anemia. Please, why please? Observation for signs of anemia is recommended. Okay. Observation for any signs of anemia is recommended. After full stop, you have to leave space. Leave single letter space after full stops, commas, colons, and semicolons. Mr. Baker staples to be removed after 2 weeks at City Hospital Clinic. Mr. Baker staples okay has been scheduled. The Mr. Baker's staples. Why Mr. Baker again? The staples are scheduled to be removed. The removal of staples after 2 weeks has been scheduled. Full blood examination, urine electrolytes and creatinine tests. Full blood examination and urine electrolytes and creatinine tests. In the city hospital clinic. Have been scheduled. So after 2 weeks, instead of after 2 weeks, this is vague. So you can write this one on 21 September. On 21 September. On 21 September. Preservation of skin integrity is recommended to avoid complication. Here we have already written for preserving the skin integrity. So there's already written. So these two things should go together. So regular daily dressing changes. Okay. And need to be continued. Then next one is if you have any further questions, do not hesitate to contact me. Yours sincerely. Okay. Why are you leaving space here before full stop? Why are you leaving space before comma? Yours sincerely. Why don't you write clearly? It is not legible. It will be considered as a spelling mistake. Don't think that they will excuse. That is why people are not getting scores. Charge nurse, leave 2 lines. City hospital. Here, leave 2 lines. 1 line. Second line, leave 2 lines. After yours sincerely. Leave 2 lines after yours sincerely. Left hand margin is maintained well. Right side also is very excellent. You did not write in the empty space. That's really I appreciate. You are following my suggestions, which I gave you in the previous letters. That's really very nice. What is stuck, Gargi? Hello?
Yes, sir.
What is stuck?
You said that the call was cut in between. It's fine now.
Okay, now it is okay, right?
Yes, sir.
Okay. It's not it's A left total replacement. So improvement is there. Last, too much improvement is there, but still a lot more is required.
Yes, sir.
Okay. So you are implementing the suggestions. Definitely it will be fine. Okay. You write a little more. Okay, at
Yes,
least
sir.
2 more lines, 2 or 3 more lines better.
Okay.
Fine. Okay, then any doubts, any questions?
No, sir. It's clear.
So fine, that's very good. Your handwriting is improved. Your handwriting is better. It's not improved. It's better only, even before. But some confusion is there that you have to avoid. Panadine fort, spelling of Panadine fort. Pana, P-A-N-A-D-E-I-N-E. Panadine fort. Panadine fort. So why don't you transform this one into word format? Okay. By our social worker is not needed. Why do you want to tell we are arranging? Okay. We are sending. Social worker is arranging. Why you want to take your credit? Okay, that is not important. That is not important. So avoid anything about yourself. I, we, you, he, she, it, personal pronouns. Better don't take your name only. Yeah. Tell me regarding the feedback. What do you think about the feedback? Are you getting proper guidance or not?
Yes, sir, I'm getting proper guidance.
Yeah. So do you want similar corrections in the future?
Yes, sir.
So implement these suggestions which I am telling you. Avoid he,
Yes, sir.
use passive voice as far as possible. Avoid personal pronouns. Use passive voice as far as possible. Avoid repeating words and phrases. Learn and use C1 and C2 vocabulary. Based on common European framework of reference. CEFR levels. Avoid spelling mistakes. Avoid spelling mistakes. And it is always better to learn some. The spellings of commonly used vocabulary on a daily basis. Try to sharpen your pencil. Try to sharpen your pencil after every 5 or 6 lines so that the fine tip will give you beautiful and thin line and makes your letter impressive. If you have, why you? In case any additional information is required, please do not hesitate to contact me. In case, comma, any additional information is required, please do not hesitate to contact me. Hesitate. So Gargi, Satija,
Yes, sir.
is that okay with you?
Yes, sir.
Anything else you require, you can ask me.
No, sir. That's fine for me.
Oh, okay then. Yeah, tell me what improvement you are gaining from these sessions.
I'm giving the improvement to improve on my writing, for to write the body of the letter. Like I have been using active voices more, and I need to make it in passive voice. And then avoiding the personal pronouns which you mentioned last feedback as well.
Right. Okay, fine. File, save, file, save as PDF, feedback. There. Okay. So your everything is placed here. So this is the letter, and here save as feedback. One. So here it is. Edit. So all your documents are there in the Telegram channel. Select all.
Okay, sir.
So I'm posting it here. And then second page, copy, select all, copy, post. Control C, Control V, Control B. So that is your letter which you submitted. Okay. And this is the letter which you got corrected. Edit, take a snapshot. Oh, sorry. Select all, copy. So sent. Then you have this one, edit, modes, take a snapshot, select all. Okay, copy selected graphic, and yeah, there is your letter. Okay, these are your points, right?
Okay.
You
Yes, sir.
know how you can collect from Telegram channel,
Yes, sir. I got that. I know
and
that.
you can don't worry, and not only yours, check others letters also. Okay,
Okay, sir.
and whatever suggestions I am giving to everyone, use them, try to okay, implement those things. Okay.
Okay, sir.
Okay, then have a nice day. Bye bye. Good night.